Hello, parents, teachers, whoever you are watching this video. Welcome to My Little Ears, the hearing clinic that specializes in children's hearing care based in London. My name is Awajimijana Otana. I'm a pediatric audiologist, but also I'm a dad to these two little beautiful girls that you can see, aged 5 and 3. And today we are going to be doing a glue ear awareness course. Imagine trying to learn a new word or follow a story or join in play, but half of the sound is muffled and no one really knows. That's what a lot of young children face day to day. This is what it feels like to have glue ear. So this training is going to give you the tools to notice what others miss so that no child under your care, be it a childcare setting, a professional setting, a religious setting, whatever the setting is, if you are responsible for a child, no child under your care falls behind because of glue ear. You see, 1 in 5 children preschool children at every given time have glue ear. So this is quite common. That's 20% of preschool children at every given time. And 8 in 10 will experience glue ear before the age of 10. So that means glue ear is more common than asthma or allergies. And yet it often goes unnoticed until there's a problem with speech, with learning, behavioral difficulties. And so we said enough is enough, and we want to change that today by giving this lecture and helping you understand about glue ear, how to spot the signs early, where to get help early, and so on and so forth. So a little bit about me. So my name is Awajimijana Otana. I appreciate that's a very long name, and so a lot of people would just call me MJ, and I'm quite happy to answer that as well. So my background is I did a master's in audiology at the University of Manchester, and after my training, I worked in several NHS hospitals, including Alder Hey Teaching Hospital in Liverpool, and some NHS hospitals here in London. And I was blessed to get a scholarship from Roche, which is a huge pharmaceutical company, to do an MBA in health at the University College London. Along my journey, I've been really blessed to be recognized by colleagues nationally for my contribution to audiology and pediatric audiology. And of course, it says there that I'm a dad. And I've also called myself the glue ear evangelist. That's because for the next few years, all I'm going to be doing, and I've been doing it for a while now, is talking about glue ear because I think the time has come where everyone needs to know about glue ear because it's quite important and it's affecting our children a lot. And I have the saying which I tell everyone, which is if children can't hear well, they can't learn to speak properly. It goes beyond that, but that's something I want us to bear at the back of our mind. Um, I've been really lucky, and I'm humbled to say that we've been able to share the news, the Glue Ear campaign, to a few key world leaders. So we met with Professor Greg Hunt, who is a former Australian Minister for Health, and we're able to share the news about the Glue Ear campaign with him. Met with Nora, who is the director of the Global Business School for Health at University College London. That's where I studied. Met with the former US Vice President, Al Gore, and again, just kept on preaching about glue ear wherever we went. And these are just a few people who I consider mentors who we've been able to share our plan and our mission with. And the key message being if children can't hear well, they can't speak well. So what would we cover in this course? So in Module 1, we're going to try and understand what glue ear is. We'll then go on to understand what the negative impact of glue ear is. We'll give you some tips on how to spot glue ear early. I think it's quite important to talk about hearing care in the UK and what the gaps in hearing care are at the moment, how glue ear is treated, the proactive glue ear management model that we put together, and some practical strategies for staff and parents to deal with children who have glue ear. And we're going to finish up with an exciting quiz. So please stay to the end. It will be really exciting. Okay, so understanding glue ear. So what is glue ear? So for us to understand what glue ear is, we need to know a little bit about how the ear works. So in the most basic form of it, our ears are split into three parts. In the most basic form, our outer ears, our middle ears, and our inner ears. So the outer ear consists of all of this part, so the pinna all the way to the eardrum. And then you've got your middle ear, that's got the three smallest middle bones in the body. And then you've got your cochlea, which is the main organ of hearing. Okay, so in the most basic form of it, the way we hear is sound will travel all the way to the eardrum. It'll vibrate that eardrum, vibrate these little bones, and then get sent to the cochlea where it's processed up the auditory nerve to the brain, and we can hear. So the focus for this training is the middle ear. So you'd see that in the middle ear, there's a little tube that just runs all the way here. Now, this tube actually is called a eustachian tube and is connected to the back of the nose and throat. Now, in children, what you find is that the eustachian tube is very different to that of adults. So you can see in this picture, the eustachian tube of the adult tilts down a little bit. It's more sort of downward sloping. And you can see the child's eustachian tube is more horizontal. And what that means is when children get colds and coughs, which they get a lot of, they are more susceptible to glue ear, which is basically a lot of fluid behind the ear. As they grow and get to the age of around 7 to 8, their eustachian tube becomes more adult-like, and which means they are less at risk of glue ear. And so what is glue ear? It's essentially fluid behind the eardrum. This is what it looks like. That's a picture of a normal eardrum. You can almost see that it's translucent. It's beautiful there, test book. And this is a picture of the eardrum with glue ear behind. You can almost see the sticky fluid behind it. And that sticky fluid is basically in this part, this middle part of the eardrum. This middle part of the ear, I meant to say. And so what does that mean? Instead of this being a nice and air-filled chamber, when sound comes in, it then meets with this fluid, so it can't transfer as easily to the cochlea, and so that barrier causes a hearing loss. It's almost like your child is underwater when you're talking to them. And you can imagine that very quickly in a little child of 2, 1, 3, whatever their age is, and how frustrating that could be. So it's very common. It tends to be temporary, but it can cause fluctuating hearing loss, and it will in most children. It would affect 1 in 5 preschool children at any given time in the UK, and 8 in 10 children before the age of 10 in the UK will have glue ear. So that's 80% of children have glue ear anyway. The episodes would last for about 3 months for the most part. They can be a little bit shorter. They can be significantly longer. Some glue ear cases, when not managed correctly, can last, upwards of a year. And even in cases where glue ear is treated, in a lot of cases, we'll see a reoccurrence of glue ear cases. And so that's why it's really important to keep an eye on our little ones, because treating glue ear today doesn't necessarily mean that it's gone forever. So what are the negative impacts of glue ear? Quite obviously, as you've seen, it's fluid sitting behind the eardrum, which means it can cause a hearing loss, anything from mild to moderate. Now, this is the way these are terms we use to communicate with our colleagues. When we say a child has a mild hearing loss, it doesn't necessarily mean that the hearing loss is affecting them day to day mildly. It's just a way that we sort of classify these things on an audiogram so that colleagues can understand while reading our reports. And what you tend to find is that the hearing loss in glue ear cases, for the most part, will fluctuate. So you might find that a child is struggling today, and next week they're not struggling as much, and then they're struggling again. And parents just can't understand whether this child is making it up and ignoring them, or whether truly they can't hear. And in a lot of cases, what we find is that children present quite late, unfortunately. And so it's already caused a speech delay, or they have unclear speech, and they're under speech and language therapy. And perhaps if their speech and language therapist is aware of this, most of them are, they would have referred the child for an assessment, and we realize, oh, they've got glue ear, and it could affect a child's behavior. So they could appear to be distracted or naughty. It's very sad. A lot of children get labeled as naughty when in fact they just can't hear, and they're really frustrated because they can't hear, but they can't express themselves. Of course, if they're very little, you can't really replicate what you cannot hear. And so they want to express themselves, but they just don't have that expressive language. And of course, if you can't hear, you can't really learn as well. And you hear that children will start speaking, but their speech is what we call unintelligible. That doesn't mean they're not intelligent. It just means that it's unintelligible to us. So when they speak, we can't understand what they're saying because they can't hear the words to replicate them, or the sounds to replicate them, or you find that they're missing out consonants and things like that. And of course, in some cases, it can affect the child's balance as well. And parents would say, my child is just really clumsy. And so these are some of the negative impacts of glue ear. There are a lot more, things like auditory processing difficulties, where glue ear stays for a longer period of time. It can affect the child's ability in the long term, even when it's gone, to be able to understand when people are speaking in background noise. And so how do we spot the signs of glue ear early? So at home, this is not an exhaustive list, but there are a few things that parents can look out for. And we've classified this into sort of everyday behaviors, communication red flags, and sort of situational cues. So if a child is always saying, could you turn up the TV, please? Could you make it louder? Or, you know, moving your hands towards the remote as a sign to say, I need the volume up, or bedtime stories on your Yoto or whatever you use have to be louder than normal, that's definitely a sign that they may have glue ear. If your child is verbal and they're saying a lot of what, pardon, that's definitely a sign that they may have glue ear. Unclear pronunciations or mispronouncing. I remember my daughter used to say, what did she say? She used to say avocado instead of avocado. And at some point, it sounds like it's cute, but actually, at the point you realize they just can't hear the sounds and the consonants well enough to replicate them. Okay, and so in a lot of cases, if a child has unclear pronunciations, it is a wise thing to check for glue ear. They may seem to ignore you, especially if you're behind them, so they have no facial cues, so they can't lip read, and so you feel they're ignoring you. It may well be that they are not ignoring you and they're not being naughty, but they just have glue ear and can't hear, because remember, that's thick, gooey fluid behind their eardrum, and that can make it really difficult for them to hear. So in terms of communication, they could have delayed speech. Some people have things around just saying, oh, don't worry, they are X gender, and they're going to talk at certain, this gender takes longer to talk or whatever. No. When a child has delayed speech, one of the first things you should look out for is, do they have glue ear? Have they had good access to sound to actually be able to replicate these sounds? Is that why they're not talking? Are they dropping their consonants? That's something you should look out for again. They're pronouncing words but always dropping out consonants. Before you think about speech and language therapy, the first thing you should think about is, can they actually hear this consonants? Okay. They might struggle to follow multi-step instructions. So if you go, could you get me the remote and then put your shoes on, please? They may struggle with that. Talking less to peers, so just not playing with other peers, talking less to peers just because they can't hear what other people are saying, so they become a bit reclusive, which leads us on to situational cues, which they could become tired after the end of the day, and that's just because they have increased listening effort, and so basically at the end of the day, they're fatigued, they're very tired. And you notice that, they're just unusually tired every time you pick them up from nursery or from school. That's something to look out for as well. If your child is particularly verbal and can express themselves, they might say they have blocked ears. You might notice that they're speaking a bit louder. So these are things you could look out for, parents. And once you find out that this is going on, you want to pick up on it, and I'll tell you sort of what to do later on in the presentation. Um, and at school, for nursery staff in the classroom, what would you notice? So you might see that the child is sort of looking at the teacher's mouth all of the time, quite intently like that. You might notice that they're underperforming in certain aspects like their phonics, no matter how much effort is being put in, or no matter how much assistance is being given to the child. This would be something to definitely raise a red flag to say, should we check for glue ear? You might realize they don't respond to their name unless you're really close or you're face to face and you're sort of eye level with them. You might realize they frequently need repetition or reminders. You're always having to repeat things to them. Again, similar thing, they're a bit more isolated, not very happy to play with other kids, like to stay in the corner, like to play on their own, mostly because they're not confident about their ability to hear and interact in a way that other kids do. Um, and they might seem frustrated, might seem a bit clumsy, again, to do with their balance and how glue ear affects that. And they might they might struggle to follow instructions in group settings. So when there are a few children around, they might struggle to follow instructions. So these are things to look up for teachers and nursery staff. Again, their speech might be unclear for their age, so it might not be age appropriate. You see a 3-year-old that can't, properly pronounce certain things you expect them to, and you can see their peers are pronouncing them properly. That will be something to look out for. You can see they don't have a very rich vocabulary. Sometimes you see some 2.5, 3-year-olds, 4-year-olds in clinic. The parent might say, oh, they've just got 20 words. You want to check out for glue ear, make sure that they don't have less vocabulary because they just can't hear the words. Yeah, so these are signs that nursery staff, that's another good one. So inattentive or easily distracted in class. And that's because, and people may assume that they're daydreaming or they have ADHD or have poor behavior, but really it's just because they tune out because they're not there, because they can't really hear. If you imagine putting an earplug in your ears all day and just, going to different lectures, how that would feel, as well as trying to consume new content as well. So it's quite challenging for the children. And so if a thing like this happens, what does hearing care look like in the UK? Okay, what does it look like in terms of what is available for a child? So what does hearing care look like in the UK? So when are the moments in time when we actually test children's hearing in the UK? So the first time a child's hearing is tested in the UK is when they're a newborn. All children born in the UK are offered a newborn hearing screen, we call it. If there's a problem at that point, they tend to refer to the hospital, to audiology, and audiology would go ahead and do all the necessary tests. If children pass the newborn hearing screen, from that point up to, say, the age of 5, when they're in year 1, 5, 6, there is no program in place for children to have their hearing screened. And this is a little bit worrying. And the reason for that is because this is also the peak age for glue ear. The options available to parents would be they can go to the GP and complain that the child are showing any of the signs that we've talked about, and GP can then make an onward referral to Paediatric Audiology so they can test the child's hearing. Now, my colleagues in the NHS, and when you read around as well, you would notice are under a lot of pressure. And so some departments would see children within, 6 weeks for their initial hearing test. And unfortunately, there are other parts of the country where children have to wait over 12 months in some cases, unfortunately, just for an initial hearing test. And so when you think about that, think about a child presenting when they're 1 and having to wait so long just for an initial hearing test. We're not talking about the treatment or anything. You see that it sort of compounds. So before the child has any meaningful intervention, in some cases, 18 months to 2 years has gone by. And we think at My Little Ears that that's not okay. And that is the problem that we are here to solve. We're here to solve that gap between ages sort of after the child is a newborn, ages 1 all the way to 5. And we fill that in with what we've designed, and we call this the early years hearing plan. So let's talk a little bit more about this, because it's the proactive glue ear management model that we've designed to make sure that children do not suffer from the negative consequences of glue ear, to make sure that we catch glue ear early, we intervene early, and to make sure that no child suffers the negative consequences from glue ear. One of the things I should note is that in a lot of cases, glue ear would resolve on its own. But even though a child has a hearing loss for a short period of time, it can still affect their development quite significantly. And so we want to know um, if glue ear is there for 6 weeks, for 2 months, for 10 months, or for whatever period of time, because we don't want there to be a period of time in this critical years where the child does not have good access to their surroundings in speech and language for development. So, what is the early years plan? So, as opposed to the traditional model where the parent has to notice that something's going on with the child, and then they go to the GP, and then they get referred, and then there's a wait, and then they get diagnosed with glue, and then there's another wait for treatment. Our model is different. We invite children in between the ages of 6 months to 7 years old, twice a year, every year, to test their hearing and to check for glue ear. And as long as the child is on the early years hearing plan, we leave the door open. So if there's any concern from the teacher or from the parent, they can always come in and have a glue ear check. And so the second thing we do in the early years hearing plan is we work with schools and nurseries and childcare providers and professionals that see children, like speech and language therapists, like pediatricians, to raise awareness, to raise enough awareness so that glue ear is top of mind for parents and all the staff, because you are the front line. And if you can spot the concerns early, it means that we can do something early. So a combined approach of educating parents and other professionals that are in the lives of children, parents and guardians, and other professionals that are in the lives of children, as well as having a proactive model where we actually bring the children in twice a year to test their hearing and check for glue ear, is the combined approach that we believe works for children, for proactive hearing care in children who are sort of peak age for glue ear, between the ages of sort of 6 months all the way to 5, all the way to 7, sorry. And so if you're a parent or a professional wanting to signpost, and so if you're a parent or a professional wanting to signpost parents to the early years hearing plan, the way to access it would be to visit our website, www.mylittleears.co.uk/early years hearing plan. And that way you can sign the child up to join the early years hearing plan. We are a small clinic based in London, and so we can only take 1,000 children for our pilot, not any more for now. And so it's pertinent that if you're listening to this, that you quickly go there and register your child, so that your child could be part of that group being monitored twice a year and having access to that excellent care. So how is glue ear treated then? So there are a few treatment options. The first one is watchful waiting. So watchful waiting is basically where we say we're going to watch, but we're going to do something while we watch. We're going to try and get rid of this glue ear while we watch. And how do we do that? So we give glue ear a time of about 3 months to say, okay, we think in 3 months most cases of glue ear would resolve. But while we're waiting for glue ear to resolve, we try to put the child in something called autoinflation therapy, which is where they're blowing that balloon, as you can see the boy doing with their nose. And what that's doing each time they blow it, you remember the eustachian tube, is opening and closing the eustachian tube. And that's a way for the fluid to drain. And we see that in some cases, children come back on the 3-month mark and their glue ear has gone, which is excellent. So typically the child would blow the balloon through each nostril for a few weeks, and they would come back in 3 months and we review. Now, of course, in most cases of glue ear, the child has got a hearing loss, so we wouldn't just send them home with a balloon. There's a little hearing aid you can see there. It's called a bone conduction hearing aid, and it just sits behind the child's ear there. So it's specially designed for cases like this, and so it bypasses the glue ear and sends sound straight to the cochlea. And so the child, while they're trying to get rid of the glue ear, is not missing out on everyday sounds and speech. And again, we found this to be tremendously helpful for children. If the child comes back in 3 months and there's no improvement in their glue ear, we then start thinking about surgical options. And this is a point where we refer to our colleagues, ear, nose, and throat consultants, and they would typically make that decision as to whether or not they want to operate on this child. It's a very straightforward operation. What they would do in that case is they would put a little incision, the eardrum, drain out the fluid, and then put this little tube you can see here called a grommet. And what that does is it ventilates the middle ear space and ventilates the middle ear space. And after a while, this grommet, a couple of weeks, the grommet actually falls out on its own, and voila, glue ear is gone. Now, if you remember, I said before, glue ear would often reappear in about 19 to 40% of children. And so that's why we're careful about just saying, let's go straight to grommet surgery, because what you don't want to do is have a child operated on who could have quite rightly not needed the operation, and glue ear could have just resolved on its own. And while they had a hearing loss for that temporary period of time, so that short period of time, they could have had hearing aids and maybe wouldn't have needed surgery. And so that's why it's sort of a decision that we make as a multidisciplinary team. So what are the practical strategies that staff and parents could do? So, you've got a child with glue ear who is attending your nursery, who's attending your school, or who is at home with you, who's your little one. So we need to think about communication. So we need to think about reducing the background noise for the child when we're speaking to them. Whether or not they've got hearing aids on, this is always helpful when we're talking to them, going eye level, tapping them on the shoulder or something, calling their name and getting their attention before we actually communicate with them. Having the child immediately repositioned to the front of the classroom, whatever setting it is, as close to the teacher as possible, so that the child has good access to the teacher's speech. Using visual signs alongside speech, just to reinforce it. Also encouraging their friends. Okay, so one of the things, especially older children have concerns about, is what would my friends think if they see me with this little dot at the back of my ears, which is a glue ear hearing aid? Well, that mainly comes because a lot of their friends are not educated about what glue ear is and how this hearing aid could be helping their friend, and how in reality they could be the next person with this hearing aids on. And so it's really important to also educate the friends so that they know what their friend is going through and they understand how to communicate effectively with their friend. It takes a little bit of practice, especially with the little ones, but we get there eventually. And of course, you want to refer immediately. And so we are working with nurseries and schools to make sure that as many children as possible are on the early years plan. And so, of course, if a child is on the early years plan, we will be able to check for this ASAP, within a matter of days, as opposed to, months. So, yeah. Okay, so that brings us to the end of the glue ear awareness training course. I hope you enjoyed it. I hope you've learned a little bit about glue ear and some strategies for communicating with children with glue ear and how to spot the signs early. And we're just going to have a little quiz, okay? Now, for this quiz, obviously, if you just watched it all along, you'll see the answer immediately after. So when I present the question, I'll advise you maybe want to pause the video, think about what the answer could be, and then play again. So that's the first question. What is glue ear? Pause the video and let's see if you get this one. Amazingly, if you said B, you were correct. It is a buildup of sticky fluid behind the eardrum, causing a temporary hearing loss. So we'll go to the next question. How common is glue ear in children? Is it 1 in 50 preschool children? Is it 1 in 5 preschool children at any given time, and 8 in 10 before the age of 10? Is it 1 in 100 children before the age of 10? Is it rare in school children? How common is it? So if you pause the video, it is B. Well done if you got that. Okay, so 1 in 5 children, that's 20% of preschool children at every given time in the UK, and 8 in have glue ear, and 8 in 10 children before the age of 10. What level of hearing loss can glue ear typically cause? Let's pause the video. So the right answer is A. Well done if you got that. And well done if you did, because you're following along and reinforcing and learning. So glue ear will typically cause a mild to moderate hearing loss. Like we said, I'm going to reiterate. Mild does not mean it's affecting the child mildly. So even a child with mild hearing loss may need some form of intervention. Which of these is a possible sign of glue ear in a child? So we just pause the video here. Is it A? Is it turning up the volume too high? Is it not following group instructions in class? Is it delayed or unclear speech? Is it all of the above? If you said D, you are correct. Glue ear can affect attention, it can affect speech, it can affect behaviour, and the signs are often mistaken for a child being daydreaming and being naughty. Poor little ones, in most cases, they're not. So why is temporary hearing loss from glue ear a concern for development? Even though glue ear can last, I don't know, sometimes 8 weeks, why is it a concern for the development if a child cannot hear as well in 8 weeks? Is it because the children usually grow out of it, so there's no concern? It has no impact on their behavior? C, even for short periods of hearing loss, even short periods of hearing loss can affect speech, language, literacy, balance, and confidence. D, it only causes ear pain. What do we think? It is C. Early years are critical. Early years are a critical window for development, and even temporary hearing loss for a short period can set a child back if it's not monitored and if they don't have any support. Which hearing devices are commonly used in glue ear management? This is a very hard one because during the training, I don't think I mentioned any of the brands. So I mainly said bone conduction hearing aids. So we'll probably do this one as a bonus and say it is Adhere and Ponto. And they are both bone conduction hearing aids. And they'll sort of go behind the ear like that. Some of them come in headbands. Yeah. What is the only way to prevent glue ear from negatively affecting a child's development? Do we just wait until they grow out of it at the age of 7 to 8? Do we rely on speech therapy when the delay occurs? Do we monitor children closely and regularly through proactive checks? Or do we just ignore it unless the child complains of ear pain? Close and regular monitoring is essential. And that is the core of the early years hearing plan. It ensures that glue ear is spotted early and managed before it causes harm. Congratulations if you are still with me. You are now glue ear aware and you've done an amazing job. Please share this lesson with your colleagues, with your friends, with your family. Let's let as many people know about glue ear as possible. My name is Awajimijana Otana, aka MJ. Here are a few references from some of the things I talked about. And it's been very lovely taking you on this journey to become glue ear aware. Thank you very much and have a lovely day.